sorry?
What about full Medicaid?
No.
You would not have full Medicaid on Humana down here. There is no plan for Humana in the Low Country or Midlands for Medicaid. People in this room should not do it.
They give a spot on the application for the Medicaid number, so that's why I asked.
Because there are plans in other states. There's actually a plan in Greenville County that is dual, but it's not down here. So you should not be putting a Medicaid client in a Humana if you're in this room, unless you're in Greenville County. You went and drove 4 hours.
Scott, these other 4 companies that are offering these dual advantage kinds of plans, we don't have anything to do with that?
Not right now. We'll get back to that here towards the end. Let's go over Humana right now. I don't want to sway away. This could be at 4 hours, and I don't want to be here at 4 hours.
Try to keep it at 3.5.
Yeah. So as you see, it's a $15 premium. Your maximum out of pocket is still at $6,700, which is the max for Medicare. The inpatient hospital did not change. The specialist did not change. The PCP came down $2 from $17 to $15. So that was a positive. One of the really big things is big is skilled nursing. The skilled nursing now has a 0 copay for the first 20 days, just like original Medicare does. So it matches up with that. Remember last year you had $25 per day copayment for certain days? That's gone. Just so you know, the care improvement's the same way too. So it's a 0 copayment for skilled nursing for the first 20 days, which is awesome. Emergency care, urgent care stayed the same. Outpatient surgery. As you know, that's one of the biggest things about Humana versus a care improvement is that the outpatient surgery is a fixed amount. As you can see, it's $210 and $260, which I think is awesome. Ambulance is $250 across the board for all the Humana plans. There is a $200 deductible, as Jim was pointing out earlier, on Tier 4 and Tier 5 drugs. So if you're taking any of the generic drugs, the 1 and 2 levels, or the preferred drugs, which is the Tier 3, it does not have a deductible for the Humana plans.
They have LIS, they don't have any deductible either.
No, LAS actually takes care of the deductible. You're correct. And then of course, Right Source, Tier 1 and 2 drugs. If they did it through Right Source mail order, they're getting a 90-day supply at no co-payment at all. No co-payment, no shipping charge. So anybody that takes more than one generic drug like that should be getting it through Right Source. And they don't have to get all of their drugs through Right Source. They do that. They can choose just their generic ones and get the preferred ones at the pharmacy at 30 days or whatever they want to do. So they can split it up. Some people think they do Right Source and get everything through Right Source. They do not have to. There is no preventative or any dental on their plans. This year, the discount should be off there. It's actually none. That's my bad for not fixing that. But there is no dental at all on any of the Humana plans.
So just one quick question about the deductible. No plan on the Humana plan except the Tier 4. So your Tier 1, 2, and 3, you don't have to go through a deductible.
That's correct. By the way, you're on question 3 out of 5. Okay.
So yeah.
Scott, this is Charleston County only?
This is the Charleston area. When you get the books I ordered for you guys, you'll have them in there. But it's Charleston, Berkeley, Dorchester, Colleton, and I think, is it Allendale? Yeah, Allendale's the one out there that is special, gets in the HMO. The Richland County HMO is the one next to it I put on there also, because we're going to have a lot of clients going to Columbia. And the Richland County HMO is really awesome. As you can see, it's a 0 copayment up there. So it's a really big.
And that's an area too? There's more than one county in that?
No, it's Richland County.
Yeah.
Yeah. So, vision services, as you can see on there, the HMO does have vision services this year, which is different from last year. Another positive for your $15 copayment is you get up to $200 yearly on your vision services for glasses or contacts, and a 0 copay for an exam.
But we can't tell them that.
No, it's a
No, you
benefit.
can't.
It's a benefit.
It's not a value-added service.
So you're in Richland, right?
No, Charleston.
That's Charleston.
The same in Richland too.
That's better than care improvement.
Yep.
Yep, it is, but we'll go over that in a minute. Over the counter. Over the counter is something that's new this year, which is big. Did John hand out the over the counter thing? Okay, there it is. No. This thing. This thing that you got is 10 pages long. this is the 2014 right now, because the 15 is not out yet, but it should be out here shortly. Right Source is actually getting the 2015 out. I got this off Humana site, but this is their over-the-counter order form and catalog. It is good to have with you because every single plan from Humana next year has an over-the-counter benefit.
Wow.
Every single one.
Private sector, these are
So this is pretty cool stuff. The local HMO here has a $40 a month over the counter. That's $480 a year. That's big. If you look at some of the products in there, I mean everything from Tylenol and aspirin and all kinds of things in there. They do have things such as dental floss, toothpaste, toothbrush, things they use on an everyday and every month basis. Allergy creams, hydrocortisone, a lot of stuff. Sunscreen. Sunscreen's on there for $7. Sunscreen costs more at the store than $7. So there's a lot of really cool stuff. Stop smoking gum. Very big. Yeah, so that's the reason why I wanted to include this catalog, put this in your book, because every single plan has over the counter. So if somebody's complaining about a $15 copayment, well heck, $40 a month you get free over the counter and it's free shipping.
These vitamins
So-
are awesome too.
So it's pretty cool. So you can show them, there's obviously a $25 gain from last year just on that, plus the $200 on the glasses. You got a big time gain from what you had last year. So, but that's a big thing.
And that's 40 a
Oh,
month. Now,
okay.
does it roll over?
No, you must order that month. If a client does not order, I think it says in the book there, by the 20th of the month, so they have time to get it out for that month. If they do not order that month, it does not roll over. They can order again the next month, but if they want to take advantage of it, they need to order every single month.
Are they gonna get order forms in the mail every month? How do they get the order forms?
You can get them to order, they probably have an agent. The agent can probably get it for them.
We just deliver our order forms every month to all of our Humana customers?
Give them 12.
Take Meals on Wheels when you go.
They can order online. They can order by calling up. The reason I wanted you to have a catalog is not to leave it with them. I wanted you to just have it to show them. They can ask for a catalog when they get their Humana cards.
Is their catalog gonna look like this, or is it actually bound together in a book like
I do not know
CFP's
that.
was?
I do not know
CFP had an actual like magazine book.
I do not have that. I'm guessing because Right Source is actually building it right now on their website. I'm guessing it's going to be bound because it's going through Right Source. I just wanted to get you all a copy of it for what it is for this year, just so you can really talk it up, because I think that's a big, big benefit. I think clients will be really happy. And every single plan is over the counter. If you look across the board, the LPPO, which is a new plan we'll talk about in a minute, is $30 a month. The medical only PPO, the ones we use for our veterans, is $50 a month.
Wow.
I mean, that's a lot of over the counter stuff. They can stockpile vitamins and toothpaste and everything.
Selling point for the veterans.
It's a zero copay.
It's a
I mean,
zero
zero
premium plan, and it's a really good selling point for veterans.
Yeah, it's definitely a great benefit for veterans because you do get all those extra benefits and you have the option to be able to go to a doctor here locally instead of having to go to VA all the time. So it's a great plan. As you probably remember, but if you don't know, if you do the medical only Humana, you cannot add a separate drug plan. That's why it's considered our veteran plan, because most veterans get their drugs through the VA. So that plan cannot have a separate drug plan. It will kick them out of that plan if you did a separate drug plan with it.
I have a dumb question. What if you're talking to a regular Mr. or Mrs. Smith and they have never signed up for the prescription program?
Mhm.
And if you put them into like Care Improvement Plus, which has happened to a couple of us, that they got whacked.
With penalties.
But they will have penalties, yes.
So can we put them in this program instead?
They won't get a penalty because there's no drug,
Right, that's what I'm saying.
but they're still going to be incurring their penalties. So you just need to make sure you're doing your due diligence to say, Mr. and Mrs. Jones, you know right now that you are incurring a penalty for not having a Part D plan.
Right.
Here's what your penalty is. You know, it's 32 cents per month right now, according to last year's 2014's costs. If I put you in this plan, you're still going to be incurring that charge if you ever do get a Part D plan later on. So you want to make sure you cover your bases on that.
That's a good point already.
Yeah, wasn't that dumb? Surprising? No, I mean, sorry.
I love you.
New plan this year is the LPPO plan. which the LPPO plan, the newest one is in Calhoun County, Orangeburg, Georgetown, and Bamberg. The good thing about the LPPO plan is it's not quite as expensive as the RPPO plan, and especially if you have somebody in the LPPO plan like in Georgetown County, that's on extra help. It won't be as
There are
bad.
2 LPPOs listed.
Yeah, I know, I didn't bring my book down with me. I'm pretty sure it's the H6609 plan.
With the
So where's
555.
that?
Huge difference. You want me to get your book? Where is it?
It's in my office.
Okay, so we'll have to figure out what counties these are available in.
Is Georgetown or where else?
The only difference is the dollar.
What? No, the Charleston HMO, obviously, we just told you around
Right,
here.
and
The
Richland.
Richland HMO, obviously know that one. The RPPO, we'll switch to that right now. That's in the entire state.
Okay.
So every single county in the RPPO for the $74 plan. I know it's a little bit higher, but still options if they want to have silver sneakers, over the counter, things like that. You know, it works out for that amount of money. And then there is a private fee for service plan in certain counties. Again, I don't think it's going to be a huge seller, but there is a private fee for service plan. But it does have prescription benefits with the private fee for service, so it's not medical only.
So which one is Dorchester?
HMO, that's a local one.
Charleston.
Charleston, Dorchester, Berkeley, Congleton, Allendale.
Local.
That was your
Not
dumb
Charleston County. Well, the other one is Richland.
I honestly didn't
County.
think I had to put Charleston local. I thought that was kind of my bad. That's what I get for assuming.
Yep.
I also put up right next to all those benefits the America's First Choice plan. As you know, we do not offer America's First Choice this year because all the plans in this area is not paying a commission. It is non-commissionable for this year. They do have plans in the upstate that are commissionable. So if you are a plan working in the upstate, that is something you can add. But all the plans down here are non-commissionable. They also are a little bit higher priced than what the Humana plans are. As you can see on there, $43 and $58 if they want one with a drug plan, or $10 without a drug plan. So I went through and could not find a reason why someone would want or would need the America's First Choice over the Humana HMO or the Humana plans at all.
What if we run into somebody that has one, at least we can compare.
That's correct.
Show them the catalog of goodies that they're not gonna be getting with their America's First.
That's the whole reason why I put it on here is because I want you to see what the benefits are. So if you do run into one, you can say, oh, okay, you got the $58 plan, and you can see
Is this what you want?
what is best for them. That is correct. There was something on top of it. I'm kind of surprised you found it that quick. That was good.
You mean those weeds?
The ones I did have. The LPPO plan, the one, the wrong one, I didn't say it. The 2.9 plan. No, that's not on there. Hold on.
Oh, God.
425, 125.
Uh-oh.
The 09 plan is 6609.
No, that's right. I just didn't. It's the LPPO. It's the other one. It's the one that says $55. I just put the wrong number on it. No, that's right. H225. There it is. Okay. It's the first one on there. It's the one that says $55.
Say the counties one more time.
Bamberg, Orangeburg, Calhoun, and Georgetown.
It's not worth writing all this stuff down. We're gonna have a catalog.
Yeah, you're gonna have a book next week. You're gonna have a book with all these plans. So I'm gonna give you one of these. The good thing about this is this book has all the plans in it. It even has all the Part D plans. And in the beginning of the book, it also has your cheat sheet that you need to have to turn them in. It gives you the whole.
I put this right in my binder.
That's your cheat sheet to fill out your books. If you remember this from last year. So I've already ordered those. They're on their way. I got an email yesterday saying they're on the way. So that's your Humana plans in a nutshell. Now, what else you need to know is one not so good thing is MUSC is no longer in Humana's network as of January 1st. So you don't want to, if a client says they have to go to MUSC, it is not in the network, they will not be accepting the Humana plans except for two situations, for a transplant or emergency.
What about existing patients with Humana?
Yeah, I'm glad you asked that, because if you have existing patients with Humana, their current PCPs will be changed as of January. they'll automatically change, and if they have a PCP that is licensed in MUSC, it's not gonna be in network anymore. Again, if you have a question about if it's in network or not, you're gonna wanna check the physician finder, that's gonna be updated as close as you
Is
can.
there some kind of correspondence going on to our existing clients, or are we gonna get random phone calls mid-January saying, I got a $1,000 medical bill not covered? Are they sending some kind of correspondence letting them know that?
Well, they're gonna have to when they change their PCP right away. I mean, they're gonna get notice that your PCP changed, here's your new card. So you probably will get some phone calls about, my PCP change is not who I want to have on there, and that's what you have to figure out and sit down and go over. I would think that you're gonna be sitting down or talking with all of your clients to kind of go over these changes. That's why we do this, is to let them know, you got a notice of change, we've got some really good things going. Excuse me, but I want to let you know one thing about it, MUSC is no longer in the network. So, as of right now, they're not accepting Humana clients at all. As of right now.
Still working on it?
They've been working on it, they obviously don't want to lose MUSC. They were the only carrier that was in network for them.
It's gonna be the other way around too. I got clients ready to jump ship and say, I'll go to Roper then if that's the case, so.
I just want everybody
Doctors, not everybody.
to be aware of that. Okay. Moving on to the care improvement. Because again, we don't want to make this an all-day thing. Care improvement's biggest things are, they're still going to have zero premium plans on any of their chronics. So any of your gold plans, your silver, and your duals are still going to be a zero premium. So that's not changing. On the regular MAPD, there is a premium of $29. So I think everybody's known that. We've talked about it for a month now. There was going to be a premium of $29. Rodney also went over it when he was here. On here, you see the silver plan. It does say that $3.40 is the premium, but it's paid by Medicaid. So don't worry about that. It's
Unlike
essentially,
Humana, LIS does work with this one, right?
yes,
So
For the
LIS
premium?
would subtract whatever.
that's correct. Depending on what level of extra help they're on, will take off that subsequent of their Part D part of it. I don't know what that is. You can go on and actually get a listing. I would have done that if I would have known ahead of time. I didn't think about that. But there is an extra help listing in UnitedHealthProducers.com. It'll tell you what the premiums are. I would, if I was you, if I was an agent out there, I would stay away from telling somebody what the plan will cost. I would tell them, you're on extra help, you will get a lower premium, but the premium starting out is $29. You will get a lower premium because of the Part D part of it. I don't know exactly what that is. You will get a letter stating that. I would just keep yourself away from saying, oh, your premium's gonna be $15 if you don't know exactly which level they're on. There's 8 different levels on extra help. And unless you call and get it from Medicaid what level of extra help you're on, you don't know. So I would just stay away from there. Just trying to keep you out of compliance issues, because it's not fun to be in any kind of compliance issue. The inpatient hospital did not change on the regular MAPD. It's still $395 for 4 days. I think that's the same as last year. Nothing really changed on the PCP and specialist. That all stayed the same, 30 and 50. On the gold plan, 25 and 50. Nothing really changed on that. It's also $0 copay on the skilled nursing care for the first 20 days. That stayed the same. Or that was the big change I told you across the board. Yeah, sorry.
No, sorry.
Across the board, which is a good change. That's a great change, because I hated when somebody used skilled nursing care and they called me and said, why is it $25 for 7 days? That's, you know, $200.
right now.
Yeah, so that's a good change. Emergency care is the same. Also, what's the same, which we still hate, and I know that's the one thing I don't like about the care improvement, is a 20% outpatient surgery. That's the one thing I really do not like. I am searching through our new hospital indemnities. I've been working with them. I haven't had a chance to search through all of them yet, to see if there's anything we can cover that outpatient surgery, or how we can cover it best. That's the one thing I do not like. Routine podiatry is back. What you need to be careful of is if you're on the gold plan and you have a diabetic and you're told them about the podiatry, it says routine podiatry, routine supplemental podiatry. They need to make sure when they're making a doctor visit, they're saying it's routine. I'm here for a routine podiatry visit. If they start doing other stuff that's not routine, they're gonna get charged specialists $50. So, there is also a deductible on tiers 3 and 4 on their plan. If you remember, Rodney said it's tiers 3 and 4, but a lot of drugs came down from tier 3 to tier 2, so you shouldn't see too much of a difference in drug prices, but it is a $315 deductible for that. Transportation stayed very similar from last year. The dental did change. As you heard from Rodney, the dental came down a little bit, and so did the vision. If you look at the vision now, the gold's only $100. The MAPD is $100 for glasses and contacts after your exam of $25. So it did get lowered down a little bit.
So go get them now.
The dental on the dual plan is gone. There's absolutely no dental on the dual plan at all. So not only is the dentures gone, but the dental totally on the dual plan is going to be gone. So you do need to make sure you reach out to your dual clients this year, because if you don't, somebody else will. But you want to reach out to them, and if your dual clients are a diabetic or have a congestive heart failure and they can switch to the silver plan, the silver plan does have dental on there, and it does have the over-the-counter benefit. That is the only one that has the over-the-counter benefit, is the silver plan on the care improvement. So the dual loses the dental and does not have over-the-counter. So if people are concerned about that, wanted the dental. Also, the vision services on the dual went down to $70 allowance from $200 last year. So it was a pretty big drop.
Yeah, every 2 years, not every.
Yeah, every 2 years. Thank you for putting that back out. I only spent hours on these, but still. Again, I put some of the extras things on there. If you guys remember, diabetes monitoring supplies is a $0 copayment if you use it in network. Again, if you want to know if it's in network, their new search feature that you can go on UnitedHealthProducers.com, their new search feature comes up with diabetic supplies, and you can look in there and see where it's in network. So you want to make sure of doing that. Hearing aids are still covered again to $330 to $380 for the copayment. I kind of put this thing on the bottom, which is a new one from last year. I thought it was really important, was labs and outpatient x-rays. A lot of people go in and have lab services when they go to a doctor, and they're always wondering about what's the charge for lab services. So I think it's a good thing to have on there. Like if you look at the MAPD plan, it's $19 for lab services in network,
Excellent.
and $15 for x-rays in network. So again, it's an extra copay. At least you're letting them know ahead of time, so they don't think they go in and pay their $25 or $30 copay for the doctor, and that's it.
So where you have none, there's no copay?
Well, it's a dual plan, so it's payment Medicaid.
So for that silver, that 30 quarterly, is that covered by Medicaid, or is that out of pocket?
That's supposed to go up to the extras.
That was supposed to go over the counter. I didn't take it out of there.
Oh, okay.
My that's 2 years. That's not too bad. It was only 2 years.
You got another one, I think.
I got another one. Thanks.
The MAPD, the numbers are all over the place.
Oh, I didn't take off the first choice either. All right, I've had a couple of. I should look through these again, I guess. My bad. First choice VIP, just so you know at the end. As of right now, they have no benefits out. First choice VIP is going to be one of those 4 carriers for the dual demonstration project that's starting here in December. It got pushed back to December 1st. Advocare is the company we're going to be working with. They don't have the benefits out for Advocare yet, so we don't have anything on them. But it got pushed back from November 15th to December 1st as of right now. They've canceled all their meetings they were going to have in person, so if anybody signed up for one, they've canceled them. So as of right now, we don't have any information about that. And the first choice VIP also did not have benefits out. So I don't know what counties they're going to be in, or if they're actually going to be fully around yet. There's
If
nothing
you
there.
run across people that have that, I actually just switched to client of mine because Walmart stopped taking it. That was a big deal. To them,
Okay.
so.
Well, that's
That
a
was
good
the
thing.
client saying that wasn't like a publication, but she seemed pretty cool.
Yeah. So I just want to kind of let you know about that. Oh, I do have that. If you do, they do have 100% extra help. Their LIS premium on the $29 plan will be $1.70. So I do have that. Huh. There you go.
Back in your
Gotta read my own. Thanks. Remember, the care improvement is an open access plan, so currently all hospitals do accept it. Currently, obviously, you have an open access plan that can always change. And the dental now is not done by Avisus. The routine dental is actually done through United Healthcare Dental. I went on there yesterday trying to look up the dental for a client. They've already changed it to the portal, which is on United Healthcare, but it's not currently up. So I did get into the portal, couldn't find any dentists because the dentists weren't loaded in there yet. So I'm guessing in the next week or so they'll be loaded in. But a lot of people, don't tell them it's Avisus, because after this year, Avisus is no longer accepting the care improvement. They're going to United Healthcare Dental. I think that's pretty much all of the benefit information.
Excellent, thank you very much.
Questions?
If somebody goes to a Humana doctor or private physician and then has an x-ray, he's getting charged for the x-ray too as a different copay than the office visit. Is that right?
No, theirs was included last year in the office visit. I'll have to double check again for this year. I did not put that on the benefits. The books, we got some books in. We're going to be putting books downstairs today. I would ask that you do not take very many books because we've only got a limited number right now. But you can have a couple of books that you're going to talk about, take out to your clients. You can't write them right now anyway. Because if you turn anything in, I will also tell you another key. It was told that if you turn in applications on the 15th of October, you will also be looked at and investigated to see why. That if all of a sudden 10 applications turn up on the 15th of October, and you did not go out and write 10 of them. So,
But if they're turning 65 in January, they're within their 3 months.
they are. I'm just telling you what they said in the training.
Well, we
That
could sell one of these next week.
you could, if they're in the turning 65, correct. You could. Yeah, their initial enrollment, that they have their SCB for initial enrollment, then yeah, you could. I'm just trying to tell you friendly things that are out there that want to make sure you don't get in trouble. I like keeping people out of trouble because then I usually get copied on and then I got to make sure everything gets answered right. So I like keeping out of trouble. Also, right now, another thing that I know we mentioned it before, but for care improvement right now, anybody that is on extra help or anybody that's on Medicaid or anybody that has a special need, that you can go ahead and get them fixed up for this year. You can go ahead and have them effective for November or December. Any of those clients, you are going to be paid on this year, and they will start renewals again in January. So I know one of the concerns that people have is a lot of the Medicare Advantages for 2015. CMS made a new rule that they cannot pay commissions except for the planned year they're effective in. So they're effective in January, you're not going to get paid till January on them. But if you can make them effective for November or December because it's a valid reason or a valid SCP, then that'd be a good idea to go ahead and do that. Care Improvement said they're going to pay out a full commission. Excuse me, and especially on new ones, you'll get a full commission on new ones, and they start renewal again in January. So it's almost like getting paid twice. So to me, that would be a good thing if I can get my clients switching to the right plan a little bit earlier. Then I would do that. Obviously, I'll make sure it's the right thing for the client. But if you could do that and somebody can get into the gold plan, the silver plan, the dual plan, whichever plan that you're looking at for them, it'd be advantageous to go ahead and do that now.
In that situation, you do 2014 apps.
Yes, do 2014 apps, and I'm glad you brought that up too. We got new 2014 apps in on Care Improvement today, and for some reason they were printed upside down and backwards. So not just upside down, but upside down and backwards. So you got to flip the book around and go to the back to start.
That'd be a collector's item.
It's a test to make sure we're really going through it with the clients.
I asked John if it was on just on a couple books. He said no, the entire pack that we ordered, which I think was 200 more I just ordered.
So you can do it like
Just went out.
It's probably the customer service that puts them together, I'd imagine.
I did order 900 more books for 2015, so we should have a pretty big order coming in. I've tried to order as much Humana as I can. Those of you that can go in and order more Humana plans, please do that. I'm trying to. Humana is the one carrier, as you all remember, that each person can only order a certain amount per week, per 7 days. So it's kind of a pain in the very beginning to get enough books in. Usually later on, it's not a big deal. We can go in and do it. It let me order another 200 books of those for right now. But then I went on and ordered some personal ones too, but there's only so many books I can have. 200 books goes really quick when you have 30 people. So I just want somebody, I don't want people to think, oh no, we're out of books, what can we do? We got plenty of enrollment forms right now, and I think they keep sending as many enrollment forms as they do books. So when we find enrollment forms, it's going to be summary benefit books, I want to make sure you have enough. I'm going to try to get a big shipment from Bob Holcomb, who's our regional manager here in this area too. So I'm working on that. That's pretty much all that. All right, so we also, whoever is doing the Walmart's, please stay behind. Whoever is in that system, I need to talk to you all a few minutes also. Anybody that's not doing the Walmart's, which is not as many, there's only a few people, then you all can leave.